What to do if you or your family develops a mild case of COVID-19, Japan expert. Japan's Ministry of Health, Labor and Welfare sent out a notice advising people with a mild case of COVID-19 to rest at home. The Mainichi Shimbun asked Jichi Medical University Associate Professor Yuji Morisawa what constitutes a mild case of the illness question. What constitutes a mild case of COVID-19? Answer: symptoms of a cold, like coughing, a runny nose, and a fever, but no trouble breathing. The person is fully conscious and alert. When the illness takes a turn for the worse, in about a week, the person starts to have respiratory symptoms, such as shortness of breath and chest pains. The thing to look out for is whether the person has any trouble breathing in addition to symptoms of a cold. Q. When resting at home, who should care for the person? A. One specific healthy person who has no underlying conditions. When interacting with the ill person, they should wear a mask, and maintain a distance of at least 1 meter. Q. How should the person who has contracted the coronavirus spend their time? A. They should remain in a single room, and not go outside. They should keep contact with family members to an absolute minimum. If a room cannot be secured for their individual use, family members living with them should always wear a mask. Windows in the room should be open for 10 minutes every 1 to 2 hours for ventilation. Q. How can family members avoid getting infected? A. The toilet should be disinfected with alcohol every time the ill person uses it. Also, the person with COVID-19 should be the last person to take a bath. Doorknobs and tables should be wiped down at least once a day with disinfectant spray or other sanitizers. Towels should not be shared. Frequent ventilation of rooms and hand washing are also necessary. Q. What if the person with COVID-19 lives with an elderly person? A. Make sure to separate the living spaces of the ill person from that of the elderly person. Barring that, have the elderly person temporarily stay with a relative. Q. What should be done if the ill person starts to complain of breathing problems or other worsening symptoms? A. In the case that an infected person with mild symptoms is resting at home, they will receive a leaflet from their municipal government. If symptoms worsen, contact the number printed on the leaflet immediately. If a family member of an infected person falls ill, they may have contracted the virus as well, so call the number. A mild case of COVID-19. Cold-like symptoms such as coughing and runny nose. No respiratory symptoms such as difficulty breathing. Conscious and alert. Note that a fever does not determine whether the case is mild or no test, and what people should be careful of when resting at home. The following has been compiled from his comments.